Is it necessary to go through PRP after a hair transplant? I'm 27, male. I underwent a hair transplant 3 months ago. Could only get PRP once 20 days after surgery. Is it necessary to continue with PRP after transplant?
Thank you for your question. You submitted a question without a photo, but you describe in detail in your question that you're 27 years old, you underwent hair transplant 3 months ago, and you underwent a PRP injection 20 days after your transplant. And you're asking, is PRP necessary to be continued? Well, I can certainly help you understand how I discuss this type of situation and comparable situations in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers. This is a technology that we developed which uses PRP, and it's a non-surgical alternative to hair transplant, as well as a solution for men and women with genetic pattern hair loss. So certainly this type of question about PRP arises constantly in our practice. So I'll explain to you a little bit of my thought process when I hear about someone like yourself. So to begin with, let's talk about your age. You're 27 and already you've undergone a hair transplant. In my mind, that means that you have an early onset and a relatively aggressive pattern, which I would suspect means that you've had a frontal hairline loss and you are having recession and significant loss. Now, when we ask the question about transplantation, you also have to understand that transplantation does have a limit. And it's one of the reasons why in my training and what has been the general philosophy in our specialty is to minimally ever operate, if at all, on people who are in their 20s. And the challenge is because the age of onset and the rate of progression will often outpace the ability of hair transplant to actually keep up with the degree of loss. When you first noticed hair loss, you already lost about 50% of your hair. So that by the time you moved forward to hair transplant, then I would suspect a much higher percentage of your hair has been lost. So where does PRP fit in this treatment plan that you have been undergoing? Well, PRP has essentially two important roles when it comes to hair and transplant, and we have to separate them. With hair transplant, like in other surgical procedures, there is an improvement in wound healing. PRP is a concentration of the wound healing growth factors and other elements of your blood, which, when concentrated, will stimulate blood supply, will improve the migration of the epidermis or epithelial cells. It does a lot of things. If you can imagine, when you cut yourself and how it heals, what we're doing is we're manipulating that physiologic process by placing PRP strategically. In our practice, we use PRP a lot. We use it for acne scars. We use it for fine lines and wrinkles. We use it for under-eye dark circles. And when it comes to hair transplant, what we generally do is actually we do a combination of PRP and something called extracellular matrix. And this is the material that I feel is the next level of stem cell-based wound healing technology. It's not stem cells being placed, but it's actually a material that stimulates your body's own stem cell response. So when we were doing a lot of transplants, we were doing this where we would combine PRP and acellular matrix during the transplant to expedite the healing of the grafts, to improve the healing of the donor area. Now, a side effect and benefit of that process appear to also stimulate the growth of thinning hairs. And that's where hair regeneration evolved from. Hair regeneration is essentially taking PRP and acellular matrix using a system that we developed in our practice where we do these injections to help people who are thinning hair and avoid surgery for the most part by stimulating the growth of their hair, by reactivating hair that's not growing, by prolonging the growth cycles and inducing the shed of thinning hairs and the growing in of thicker hairs. And what's interesting is that with either one or at most two injections, the overall majority of our patients have sustainable growth for about 5 years. And so we have over 7 years of experience at this point in time. So that brings me to helping you understand the part of your question about the sustaining of PRP. The question that I think that your doctor probably also has proposed to you is, how do we keep your hair from at least slowing down the progression? And so we can distinguish, we can actually differentiate what is available to you. One is the drug finasteride. Finasteride works by lowering the levels of DHT or dihydrotestosterone, which can have an effect on the progression of thinning. And so when the drug is taken daily in 1 milligram dosage, it lowers your DHT levels. It may or may not work for you because there is a certain rate of progression that is often genetically very strong. And however, it's been my observation that a DHT blocker can be effective in slowing the progression. Now, where does PRP fit in, or where does hair regeneration fit in? Well, we're talking about with this mechanism, we're stimulating hair growth. Now, the differentiation between hair regeneration, what we do, and PRP is that PRP cannot sustainably maintain hair growth in my experience, for more than 3 months. I think that in general, my colleagues who are doing exclusively PRP for hair loss will have a patient come in at least once every 3 months. If not, they will even bring them in earlier. I see it as a short-term burst of growth, and that still but requires continuous treatment. So a lot of people who have come to us who had PRP injections done elsewhere felt that they couldn't keep going every month and not have no endpoint in sight. Like, can you really sustain that? In many ways, it's almost a setup for failure, because a person can only willingly get injected in the scalp so many times in a given year before they start to fatigue. And so I think that there is a big differentiation to be understood there. So that's where hair regeneration has been very successful, and we treat people from all over the world, and we have patients who cannot in any practical way come back to us that frequently. So we've been able to prove this over many years of doing this, that this combination and algorithm we developed works in that respect. So how does this fit in a treatment plan for you? Well, I would probably, in a situation like yours, I would suggest that you strongly consider taking finasteride to slow things down, and I would recommend a treatment like hair regeneration. If something like this hair regeneration treatment is not available to you, well then at least consider the PRP injections to try to push the growth of your existing hair, possibly to help your grafts as well, but to understand that you're trying to delay as long as possible the need for a second transplant. Unfortunately, a lot of young people who have gone this route of transplantation will keep doing it, and then by the time they hit their mid to late 30s, they've lost their native hair. They only have their transplanted hair, which doesn't look very full at all. It actually looks like their hair is thinning, which is not a very satisfactory outcome. So it's very important to have a plan for your stabilization and prolongation, and probably stimulation of the growth of your existing hair. So I hope that was helpful. I wish you the best of luck, and thank you for your question.